Good afternoon and welcome to the New Jersey Influenza Action Group's final meeting for this season. Next slide, please. We will be starting the meeting today with a presentation, Influenza, the Case for Immunization of Healthcare Workers. My name is Amy Gall and I'm a consultant with the Partnership for Maternal and Child Health of Northern New Jersey, working on the Power to Protect New Jersey campaign. The partnership is providing today's program. Before I introduce today's speaker, I'd like to review some information. As one of the program planners, I disclose that I am the CEO of GuillainBarre, a for-profit company which provides educational program development and support. The other planners and speaker do not have any conflicts of interest to report for this program. Next slide, please. Immediately after the webinar ends, as well as in an email, you will be invited to take a post-program evaluation. We appreciate your feedback, so please complete the survey. To receive a certificate of completion, including 1 nursing contact hour, you must log in, listen to the entire webinar, and complete the evaluation. Certifications of completion will be sent via email within 1 week of the webinar broadcast. This program is being recorded and will be available on our website and YouTube channel until February 14th, 2024. All attendees' microphones will be muted during the presentation, but our speaker would love to hear your questions and thoughts. So please use the question box and Dr. Kitt will respond to as many as possible at the conclusion of the program. And now it's my honor to introduce our featured speaker, Dr. Eimear Kitt. Dr. Kitt received her medical education at the Royal College of Surgeons in Ireland and completed residencies in Australia and Massachusetts, as well as a fellowship in pediatric infectious diseases at the Children's Hospital of Philadelphia, or as we call it here, CHOP. She is currently an attending physician with the Division of Infectious Diseases at CHOP and Associate Medical Director of the Infection Prevention and Control and Program Director of the Infectious Diseases Fellowship Program. Whew, we got through that. She co-leads the hospital-acquired viral infection committee in CHOP's harm prevention program and has an interest in the epidemiology and diagnosis of respiratory viruses in children, including vaccine-preventable diseases like influenza. Dr. Kitt, welcome. We are thrilled that you were able to make time in what I'm sure is a more than busy schedule to speak with us today.
Thank you so much, Amy, and thanks for having me. I'm so excited to be here to speak to you all about something I feel very passionate about. And so with that, we'll get started. So what we'll do today is just review, I think, what won't be news to you, but some highlights about the background of influenza and also the significance, not just to the general population, but also to both the pediatric population, because I work in pediatrics as a pediatric infectious disease physician, and also to healthcare workers in my role as an infection prevention associate medical director, and also with the harm prevention program. I feel very invested in preventing harm for both our patients but also our staff. So we'll review background and significance. We'll also review the current state of the influenza vaccine within different healthcare settings and review the evidence for influenza vaccine for healthcare professionals. We'll approach some common reasons for refusal. It is still not uncommon to experience vaccine refusal, and we'll review specific reasons for refusal in the flu vaccine. We'll then review a few cases specific to what we have discussed, and then we'll go through some of your questions at the end, and happy to answer as many as I possibly can. So first up is flu significance. So CDC does surveillance yearly using a FluSurvNet, which is a influenza surveillance network. It includes 15 states throughout the US. And then from this surveillance, it does modeling of what it estimates yearly according to the FE that it tracks. So yearly, up to 41 million patients or individuals will get ill from flu. Up to almost 750,000 will be hospitalized, and at times up to 50,000 and more deaths will be documented. This was quite atypical these past 2 years with COVID. It was certainly not a typical flu season, but flu did still, it was still documented last year. We actually had 1 pediatric death, and this year it has certainly come back. I think one thing to note is that high-risk conditions in particular to highlight are children under the age of 2, particularly under the age of 6 months, as those children cannot be vaccinated. Adults over 65 years, those who are chronically have chronic conditions or comorbidities or perhaps immune suppressed, pregnant individuals, and then racial and ethnic minority groups are being increasingly recognized as high risk. This in part is due to a vaccination difference between different groups. And so influenza in children, I'm a pediatrician, so I see this commonly, but millions of children get flu yearly. I know there's a perception that it can be a mild self-limiting illness, which it can be, but it also causes plenty of complications, both doctor visits for ear infections and pneumonia, hospitalizations for dehydration. Up to 26,000 hospitalizations have been documented yearly. And I think at its highest, we had 200 deaths. 80% of these deaths were in unvaccinated children. Also wanted to highlight that there are disparities in severe flu outcomes with much higher outcomes of hospitalization, ICU admission, and in-hospital mortality in racial and ethnic minorities. And so what about healthcare workers? And so this is something that I am particularly interested in, but the incidence of influenza in healthcare workers is significantly higher than that of the general population due to the exposures, just the jobs that we do. So 2.5 times more likely to get symptomatic influenza infection if you're a healthcare worker. Up to 1/4 of us will have influenza yearly. Again, this was a little atypical in the past couple of years, but we are seeing flu back again, and it's certainly not going away. So what are the reasons for this? Well, apart from the exposures, adults can also have asymptomatic infection. So interestingly, it's been shown that healthcare workers, because we maybe have been exposed to different viruses, including flu over our life and over our career, up to 90% of healthcare workers may have either asymptomatic or mildly symptomatic presentations. Similarly, viruses can be shed for up to a day before you actually have symptom onset, so before you even realize that you're sick. And so all of this has significant impact on both ourselves, our lives, our hospital environment, and the kind of general economy. It leads to more absenteeism, which is just missing days from work, and also leads to presenteeism, which is the concept of being present while sick at work. That in and of itself has risks, both in terms of healthcare associated infections, so can lead to a transmission event to patients, including high-risk patients, and that can subsequently lead to clusters and outbreaks within units and institutions. And all of that together can have a large socioeconomic burden. So what is the current state of the influenza vaccine in our healthcare system? So we'll just review a couple of different settings in which flu vaccine has been studied in terms of its impact to outcomes on both patients and absenteeism. And so there was a cluster randomized trial performed, I believe this was in the Netherlands, and it looked at 3 hospitals who had an intervention of an educational program for influenza, and then a similar number of hospitals who had no educational program, and compared vaccine coverage in both the intervention and the control. Also looked at patient related outcomes. And so what they noticed was that there was a significant increase in vaccine coverage in the intervention group, so in those who received the educational intervention, 1.5 to 2 times the number of staff actually got vaccinated compared to control. They also noticed what was impressive was a significant decrease in comorbidity. So in the vaccination group, when the healthcare workers were vaccinated, there was significantly less healthcare associated or nosocomial influenza and or bacterial pneumonia in those two different groups. So 3.9% in the vaccinated group and almost 3 times that in the control group. A similar study looking at sort of a related outcome looked at a nested case control study, and what this was trying to elucidate was what is the protective effect of the flu vaccine on patients. So in patients who get flu, how do they compare in terms of who was caring for them? What proportion of healthcare workers were vaccinated versus unvaccinated? And what they demonstrated was a shielding effect or a protective effect of 35% of the vaccinated healthcare workers on healthcare-associated infections among patients on hospital wards. So certainly not insignificant. And so this I will actually come back to later on, but just also wanted to show this hospital setting. So this is actually data from CHOP. So we reviewed our vaccination rates and our healthcare-associated influenza rates at CHOP over a 10-year period since introducing an influenza mandate for the vaccine. And so you can see that as the rates, which were always fairly good, at least from kind of 2008 on, as the rates consistently became high, you can see that there was a temporal trend down towards less healthcare-associated cases of influenza. Obviously, this wasn't the only thing that was going on. We had a lot of harm prevention work, a lot of work on hand hygiene and just education of staff in general on transmission of viruses, but certainly looked convincing to me, at least, that there was a trend that was associated with increased vaccination of healthcare workers. And so what about the outpatient setting? Many of us work in the outpatient setting where we see many patients with influenza. This top graph, it's a little difficult to see, but it is looking at absenteeism or days absent from work in outpatient providers. This study is called the RESPECT trial, Respiratory Protection Effectiveness Clinical Trial. It was conducted over 3 influenza seasons at different geographically distributed healthcare sites, which is important because the flu vaccine and the flu seasons vary from year to year. But it looked at 3 sites that mandated flu vaccine and 4 that did not. And the take home from this study for me was that among healthcare personnel who reported at least 1 sick day, vaccinated healthcare workers had lower symptomatic days compared to unvaccinated healthcare workers. Similarly, this is of interest to us in the pediatric world, where we have a lot of children admitted for respiratory infections throughout viral season. And so there was a randomized control trial done comparing vaccinated versus non-vaccinated workers within pediatric institutions, and they found reduced absenteeism by 28% in those who were vaccinated compared to those who were not. Nursing homes and long-term care facilities is another very high-risk group with elderly population with often many comorbidities. And there's a lot of interest in determining whether this group should have healthcare workers who are required to have the flu vaccine. And so this was a study done looking at the effectiveness of an influenza vaccine program, specifically looking at the outcomes of death, morbidity, and health service use among residents. This was a UK study. And the number of staff vaccinations needed to prevent 1 death in this study was calculated to be 8. The number of vaccinations needed to prevent a case of influenza-like illness was 5. 1 GP or primary care consultation was 6, and 1 admission to hospital with ILI or influenza-like illness was 20. And you can see in this graph just an overall trend for as high as the vaccination rates in healthcare worker gets higher, the mortality among the residents of the nursing homes seems to have a temporal decrease. And lastly, just a study that I had reviewed that I really thought did a nice job of kind of combining all the different evidence for improvements in patient in healthcare worker outcomes. So this first study, Bologna from 2016, looked at cases of healthcare workers attending their physician for flu, and you can see for all types of flu, the first two types, H3N2, H1N1, and flu B, there was a significant decrease in medically attended influenza vaccine in those infection in those who were vaccinated. The next studies here, Saxon and Fury, looked at work days absent, so absenteeism due to respiratory infection. Again, you can see a significant decrease, reduction in outcomes related to that. And then lastly, of course, we all care about patient-related outcomes and patient safety. So patient mortality, they noticed significant reduction in patient mortality from having healthcare workers vaccinated. So with all that evidence presented, how are we doing? So this graph is from CDC. It looks at the overall percentage of healthcare personnel who receive influenza by work setting. And you can see that the hospital settings is at the top. It's actually doing pretty well here, generally over 90%. And then at the bottom, you see long-term care facilities overall a little lower. And it's interesting. I mean, why would a hospital be so much higher than a long-term care setting when both house and care for very high-risk patients? Personally, I think one of those reasons is that there are more hospitals that require and mandate flu vaccine, and we'll touch on that in a little bit down the line. So one question that comes up all the time is how to approach common reasons for refusal. And so various individuals will have various reasons for flu vaccine, and in particularly in institutions such as CHOP that mandate the flu vaccine. This comes up every season when we review exemptions. And so I'm going to just go through a few different reasons why people decline flu vaccine. Now, this is data from quite some time ago. We actually brought our flu vaccine mandate in 2009, and right before that, we did a review of why people opted to not get the vaccine. And so you can see that before the flu vaccine was mandated, the two biggest reasons for declining the flu vaccine was either a concern about side effects or personal choice. There were other reasons, including concern for allergy, religious reasons, pregnancy had come up, and fear of needles. But if you think about these in terms of buckets, the biggest ones that I find come up for me are, number one, allergy or reaction. So a concern for either allergy to a specific component of the vaccine or vaccines in general, or a side effect of the vaccine. The second is pregnancy. That often comes up as a concern, and folks often want to educate themselves and ensure it's the right thing for them and their baby. And I think that is absolutely important for them. And then lastly, not to bucket them together, but often religious and personal reasons do go together for various reasons, and we'll talk about each of these. So first up is allergies. And so this slide is from the Vaccine Education Center at CHOP, which has really great educational resources. It has tons of information on specific vaccines, side effects of vaccines, contraindications, and just educational content. But there certainly are side effects from the flu vaccine. However, they are significantly less than the actual flu illness itself. So you can certainly get pain and some swelling at the injection site. You might have a day of feeling a little achy, or maybe even a low-grade fever. The live flu vaccine, the intranasal vaccine may even give you some mild congestion. And then there is a concern for a rare side effect of a neurologic condition called Guillain-Barre syndrome. However, I think it's important to note that this side effect is significantly more likely, 17 times more likely, in fact, if you actually get flu itself. So if you get the vaccine, I think there's a 1 to 2 per million rate of possibly getting Guillain-Barre. But if you get the flu illness itself, or the flu virus, then your risk of complications are significantly higher. So what are contraindications to the flu vaccine? So just like with everything, there are absolute contraindications to the flu vaccine. There are always situations where you should not get it. For now, those are children younger than 6 months. It has not been approved for children younger than that age. And then if you have been shown to have a severe life-threatening allergy to ingredients in a flu vaccine, be it a preservative, or something else that you've seen an allergist for, then you should not get the flu vaccine. Relative contraindications include a previous reaction to a flu vaccine. Often this involves a conversation with your healthcare provider to understand the extent of that reaction. And then this previous diagnosis of Guillain-Barre syndrome. This is also a conversation with a patient. So the actual diagnosis of Guillain-Barre syndrome in and of itself, like I mentioned, is incredibly rarely possibly associated with the flu vaccine, but still much higher with the flu virus itself. And so just because you've had it before doesn't mean you absolutely cannot get the flu vaccine. It just means that it's a conversation with you and your healthcare provider. And so what about egg allergies? And so egg allergies for quite some time had been a contraindication to receiving the flu vaccine. Some flu vaccine are actually grown in eggs. That's how they're manufactured. So there's a teeny tiny amount of protein from an egg that is theoretically possible and is in the flu vaccine. However, it has been shown after much research that there's really no reaction to that egg protein. And so it's gotten to the point where the Society for Allergy and Immunology has recommended that those with egg allergies can receive any licensed and age-appropriate influenza vaccine. There are vaccines completely egg-free, but it's interesting that these organizations don't even recommend asking about egg allergy routinely because they feel like it's such a low risk that it's not even worth asking. Those with severe egg allergies are actually recommended to have the vaccine under the supervision of a healthcare provider. They're not recommended to wait any longer, but this is just, I think, for reassurance for everyone. So a second reason that I often hear, and I often have friends, family members, colleagues come to me to ask about this, is pregnancy. Is the flu vaccine safe in pregnant individuals? And so pregnancy itself is a very high risk condition. There's significant risks associated if you get flu while pregnant. Has to do with kind of hemodynamic changes within your body, your lungs, your heart. You're relatively immune suppressed as a pregnant individual. And so flu vaccine has been shown to reduce the incidence of both flu and also hospitalization from flu. Also, I think importantly, the risks to the baby. Flu is associated with reduced birth weight. So flu in the mom is associated with reduced birth weight in the infant. Also has been associated with preterm delivery if the mom is sick with flu, and also infant mortality. And for this reason, the American College of Obstetricians and Gynecologists, along with the Advisory Committee on Immunization Practices, recommend that pregnancy is a high-risk condition and that pregnant individuals receive the flu vaccine. So in terms of the actual data supporting this, which is often what folks want to know, the flu vaccine will reduce your risk of flu-associated respiratory infection in pregnant individuals by about 1/2. It will reduce your risk of being hospitalized as a pregnant individual by about 40%. It also protects the baby from flu by giving the baby antibodies when they're born, especially because they'll be too young to be vaccinated until they're 6 months of age. And if the individual chooses to breastfeed, then those antibodies are also passed along in the breast milk. There had been some concern based off one study that had come out and was subsequently shown to be flawed in terms of its analysis. That study had queried whether there was a risk of miscarriage with the flu vaccine, but that has since been shown to not have been the case. The one thing we do recommend for pregnant individuals is that they do not receive the intranasal vaccine. This is more due to a theoretical risk than an actual risk, but we in general do not give live vaccines to pregnant individuals, and the intranasal vaccine is a live vaccine. So we just recommend that they get the other intramuscular vaccine instead. So moving on, other reasons for refusing to get the flu vaccine. The next and possibly most trickiest to navigate is that of a religious or a personal reason. And so I think when I think about religious reasons and personal reasons for not wanting to get the flu vaccine, I, as a infectious disease doc, a pediatrician, have sort of gone to the evidence to see, are there organizations that actually recommend that you do not do this if you are of a certain religion. And so interestingly, I have found, and I think it's helpful to know this, that no major religion prohibits vaccination. The majority of Christian denominations have no objection to vaccines. There are a small group of smaller religions that rely more on faith healing rather than medical care, and they apparently do have some objection to vaccines. Jehovah's Witnesses until 1952 had recommended abstaining from vaccination based on scriptural passages, but these are no longer thought to apply to flu vaccine. And then, as you can see here, both Judaism and Islam have clear positions in support of vaccination, along with Buddhism, Hinduism. I think in general all support the need to sustain human life, which of course vaccines help us to do. And then a very common personal reason that I have had come up, again from friends and family, is, I never get the flu. Why bother getting this vaccine? And so, it's an interesting perspective to have, because I think it's easy to remember or easy to forget that the risks associated with flu. We're not all around critically ill people who have flu. And so giving the perspective that no one is 100% protected is really important. We may have mild symptoms or be lucky to have flu and be asymptomatic, but that doesn't mean that there aren't risks to others. And so highlighting that as a healthcare worker, you're still 2.5 times more likely to be at risk, and that the vaccine will reduce your risk of being absent from work, being present at work, and theoretically a risk to high-risk individuals, and also seeking medical care and having to miss time off for that is important. During the 2019 flu season, it was estimated that the flu vaccine prevented over 100,000 flu-related hospitalizations. And then even in those vaccinated individuals who actually get flu, it's also been shown that even if you get the flu virus while being vaccinated, you still have a reduced risk of poor outcomes. So a reduced risk of hospitalization, a reduced risk of being admitted to the intensive care unit, and of course, a reduced risk of death. From a patient perspective, and I know I see this within our institution, but there is a risk of healthcare-associated infection from individuals who have flu, either asymptomatically or mildly sick. And that's why we always tell people to go home when they're sick, but you're less likely to be sick if you have the flu vaccine. And then a societal risk, of course, we may consider ourselves healthy and lucky to be so, but we are not around people who are all low risk, and certainly have many high risk individuals within our society that need to be protected. So this is a publication just from last year that I thought was interesting. It reviewed religious and or personal reasons for declining the flu vaccine. And you can see a lot of these themes will fit into the kind of buckets that we mentioned. So a lot of folks cited organized religions, a lot of concern about the flu vaccine being ineffective. I don't get the flu, concerned about side effects, vaccine causes the flu. So a lot of these can really be approached with just objective facts and education of folks who just honestly may not know. There is a good argument that the flu vaccine is not perfect. I think that often will come up. People will say, well, the flu vaccine doesn't always protect the flu. I got the flu vaccine and I still got the flu. And I think that's a good point. The efficacy of the vaccine varies from season to season. It has varied between 10 to 60%. So it's certainly not perfect, but I think it does reduce both personal, patient, and societal risks. I think we have a duty to ourselves, our families, and our patients to reduce that risk as much as we can. So what are some ways to improve vaccination? So first thing is make it free. No one should have to pay for a flu vaccine. Make it available. One thing I really appreciate as a healthcare worker is when there's a flu vaccine just literally in front of me and I don't have to think or schedule. I can just go and get it. And so Often institutions, hospitals, outpatient practices will have flu vaccines and flu vaccine clinics available at sort of atypical times of the day. Personally, I've gotten it overnight, just on a night shift. And I just really liked that accessibility. I feel like that is key. Communication and education is important, particularly on those side effects and some kind of misbeliefs and miscommunications, and advertise it. When it's flu season, announce it. Have digital signage, have posters, have folks champion the flu vaccine, and really highlight those high-risk groups, because that is who we absolutely need to be both targeting and protecting. So education is key. And then one thing that has been tried, and we tried it in CHOP, and I'll mention our timeline for doing this later, but declination forms are another way of sort of highlighting to an individual the potential significance of a decision. So a declination form is when you kind of very consciously opt out of a vaccine. And so it's definitely easier to say, I think I'm just not going to get the flu vaccine. I don't want to feel a little unwell tomorrow. I don't get the flu. I'm fine. But when you have this form that says that you thoroughly understand that you are potentially putting folks at risk if you are asymptomatically shedding, or if you are around high-risk individuals, and if you fully understand all of these points, then you sign that. It, I think, has more impact and really makes you reflect on the significance of the decision. And so this has been used fairly successfully in many different settings. So I thought I might just quickly go through the CHOP experience. As I mentioned previously, we've mandated the flu vaccine for healthcare workers since 2019, so just around the time of the H1N1 pandemic. And so we made a lot of gains. From 2005, we had up to about 70% vaccinated. We did introduce those declination forms, got up to about 72%. We then made the declination forms mandatory and slowly got up to about 80%, and then did some intensive education on those folks that declined. Ultimately, unless from 2009 on, unless you had a medical or religious exemption, you were mandated to have the flu vaccine at CHOP, like many other centers now do. And so just showing those graphs again from previously, but you can see that that mandate really kind of got us up to well over almost 100, but 99.7% of healthcare workers at CHOP. And similarly, like I showed before, I think this was fairly impactful for me, just seeing the numbers of healthcare associated cases at CHOP decline. And again, there's many factors, including seasonality and many other initiatives that we have to reduce this, but certainly was promising in terms of a trend. A couple of other just papers highlighting the importance of or supporting an influenza mandate. This was a JAMA study from 2018 that looked at a survey done the year prior and found that more than 2/3 of non-VA hospitals actually mandated influenza vaccine in healthcare personnel. As of summer 2017, less than 5% of VA hospitals were mandating this. However, the following year, since this study, the Veteran Health Administration did release a directive to increase influenza vaccine in this high-risk group, and so they have made progress in that since then. One very good resource that I also like to mention is the immunize.org influenza vaccination honor roll. And so you can see how many organizations are on the influenza honor roll, which is they mandate the flu vaccine at these various organizations. So there's almost 1,200 healthcare settings now enrolled, and you can look and see different organizations. I know CHOP is on there and many others, but it's just a really nice, and you can actually submit for your own organization to be on there. So I thought I might just review a couple of cases. We have about 3 cases to go through, so happy for folks to either enter the chat, or I don't know if we can shout out answers or not, but you just let me know what you think the right answer is, and then we'll chat about them. So first case is a 25-year-old colleague reports a long-standing history of egg allergy, documented anaphylaxis. So has an EpiPen, it is a legitimate egg allergy. So they request advice from you on the best influenza vaccine to get this season. And so you tell them to A, avoid all types of influenza vaccine and wear a mask. B, receive the live vaccine only. C, receive an egg-free vaccine only. D, receive whichever influenza vaccine is available to them. And E, none of the above. And so I'm just looking in the chat, but I'll just go ahead with the answers. And so this individual has a significant, you could say life-threatening egg allergy, but just like we talked about, because of the very small amount of egg protein present in the vaccine, this is not actually felt to be of significance in the flu vaccine anymore, and therefore they can receive whichever influenza vaccine that they find available to them.
You tricked the audience because we had a lot of C's.
Oh, really?
Mm-hmm.
Yeah, I mean, that's kind of a trick question because you could also, I've had people adamant that they don't want to get the flu vaccine because of egg allergy. And I have said, well, you know, the recommendation has been that you can get any of them, but there are also egg-free vaccines. So, you know, if somebody felt very strongly, they can certainly get an egg-free vaccine, but they're actually able to get whatever one that they wish. There are some vaccines that are not grown within eggs, so. All right, so it was D. Next up is case 2. So a 30-year-old employee has a history of facial palsy secondary to suspected Lyme disease. They have read that their neurologic condition may worry if they are to receive the influenza vaccine, and they voice concern to you about taking it. You inform the employee that they A, should avoid the influenza vaccine from now on, B, should avoid the live influenza vaccine, C, receive whichever influenza vaccine is available to them, and D, none of the above.
All right, we've got some answers coming in. Let's see. People want to keep typing in. We've got a mix of B's and C's.
Yes, the answer is in fact C. So because of the association that was postulated between Guillain-Barre and the flu vaccine, there's often a kind of misconception that any neurologic condition may worsen, but in fact, it is very specific for GBS. And so they should receive whatever influenza vaccine is available to them and should not expect to have any worsening of their condition. And last case is a 35-year-old healthcare worker requests evidence on why they should receive the vaccine. All their life, they have been fortunate to be healthy and state that they have never gotten flu, despite never receiving the vaccine previously. You inform them that they either A, can be contagious without knowing that they have influenza, B, that they're increased risk of getting influenza as a healthcare worker, 3, that they are C, they may pose a risk to patients and colleagues who are at higher risk of flu than them, and 4, that they are likely to have less sick days if they receive the flu vaccine. Or lastly, 5, all of the above.
I think people are paying attention here. You got a lot of 5s coming through.
Emily's answer. Great, it is all of the above, yes. But it's a common question, you know, people want to know the evidence, like why should I get this vaccine? And I think we have that evidence, so knowledge is power, and letting them know that is usually persuasive. So great job. Okay. Just wanted to touch on a few different resources available to everyone. So the CHOP Vaccine Education Center, I'm just giving them a plug. They have just a tremendous amount of resources available. They go through every vaccine, every ingredient. They have videos from my colleague Dr. Offit and all of some of our other ID colleagues, lots of educators on little videos on specific FAQs and topics that come up. It's a really good resource. CDC has an excellent flu vaccine section It has a whole section of flu where it talks about surveillance per year and gives really great kind of graphs and pictures of the flu burden throughout the US. But it also has a really nice digital media toolkit. So has, including just like this picture here, it has lots of posters and digital media that you can download and use for your different organizations. And then immunize.org, I use all the time as a resource. We sometimes get very specific questions for vaccines, including the flu vaccine. And this has really great information and has that flu honor roll on it as well. And so I often get children asking me, why are you giving me the flu with my flu shot? And it's just an ironic observation. So we tell them to think of it as virus protection software. Usually works. And here are my references. So most of these are in reference to the studies that we discussed. And I am very happy to take any questions.
Thank you, Dr. Kitt, for an enlightening presentation. As a grandma whose 3-month-old grandson contracted flu, I'm certainly very well aware of how important the vaccine is to protect those who we can't protect. We do have some questions from the audience, but I just want to let everybody know that the question box is still open. So if a question pops into your head, feel free to enter it and we will try to address it. So the first question I have is about Guillain-Barre. So in the dark ages, when I went to nursing school, we were told that there was a correlation between the vaccine and Guillain-Barre. And then more recently, I read something that said there really isn't any relationship. So I wasn't exactly sure from your presentation whether you were saying there is a small relationship or just that people think there is a relationship.
Yeah, that's a great question. Honestly, I think it's more of a possibility rather than a proven one. And so even when you're on the CDC website or, you know, the Vaccine Education Center, you'll see them say that like this in theory is a risk of the vaccine. I think there was one study that showed maybe it was, but it was a signal. So obviously folks wanted to take it seriously. So it's a teeny tiny, like 1 to 2 per million case risk if present, and hard to prove for sure. But I think something that we call out as a possible contraindication just in case. So you're right, it was sort of, yes, it was likely a side effect. And then more recently, it's been a maybe actually it's not after all, maybe it's something, something else. We definitely know that there's a relation with the flu virus itself. So I think that sort of theoretical risk stemmed from that. So for all of those reasons, we just say that it was a signal that we saw. It's something that we call out. It may or may not be there. It's still higher with the virus than the vaccine, but we do discuss it as a relative contraindication. But that's a really good point because it's actually not clear to me that it truly is an association.
Great, thank you for clarifying. Sometimes things are a little murky. Can you talk a little bit about how the pandemic has changed our approach to the influenza vaccine?
Sure, yeah, I think when I think about the flu vaccine, particularly in healthcare workers, I'm often, wondering how our attitude has changed, particularly over these 2 years. And so I think waiting for the COVID vaccine, we were all kind of almost in hiding, just waiting for some extra protection. That kind of approach and that general increased awareness of transmissibility of viruses and how they get transmitted and how we prevent them and how we protect ourselves, that has really helped, I think, acceptability of the vaccine. So I've definitely heard of people just eager to get the vaccine. However, I have ironically noticed that there seems to be more barriers to getting it, not necessarily within healthcare settings where it should be freely available, but within the community where maybe people aren't as comfortable going to get the vaccine to an actual healthcare facility. So ironically, I think that it is both increased from an acceptance standpoint, and maybe the rates, we've definitely noticed that the rates have been lower of influenza vaccination, and I think that's because of just accessibility, but I also think it's because of awareness. So we're all kind of thinking about COVID. The flu vaccine last year was the flu season last year was essentially non-existent. This year we have had a flu season, but not as, I think, severe as we thought. It still has, led to a lot of cases, but at the same time, I think heightened awareness will be necessary going into next year, because I sense that next year's flu season will be back to its regular cadence.
And that was one of our questions. Are we in for a more severe flu season next year if COVID is circulating widely again? Do you have a crystal ball?
I wish I did. I think COVID is just keeping us on our toes. We just got through this last Omicron surge, or at least we're still getting through. I think COVID is here to stay, but I think flu will be here to stay. We still saw it this year, albeit milder. We still had kids admitted and definitely saw flu circulating. And so I think we'll be getting back to our normal. We're all on the road to recovery. Viruses will circulate for sure, and I think flu will be one of them. I do think that just general education and awareness of viruses and transmissions, and probably some degree of masking, will continue for the foreseeable future. At least I know I feel much more protected with the mask on, and so I think that will mitigate some transmission. So I'm not sure if it's going to be a severe flu season, but I'd say we'll be back to prior cadence for sure.
Thank you. And this is another, we've got a few flu COVID questions.
Oh, yeah.
So here's another one. Now that flu has been compared as, in quotes, less severe than COVID over the past 2 years in terms of mortality, morbidity, how do we change the message back to helping people recognize the severity of the flu?
Yeah, that's an excellent question. I was actually looking at a graph the other day of hospitalizations from flu versus hospitalizations from COVID. And obviously I'm biased towards children, but it was a graph looking at the different age groups under 18. And you can just see this kind of like slow increase of COVID-related admissions that we just kind of peaked at here a few weeks ago. But that flu, the last 2 seasons of flu have been atypical, but prior to that, the flu-related admissions and morbidities have been consistent throughout, and we have hundreds of thousands of people dying from flu. So I think the message will need to change. I think we will soon shift away from just the COVID focus. I think it will become an endemic virus and kind of start to, we'll start to get back to our normality, and I think we'll be able to highlight flu again. I certainly am working to do that with friends, families, healthcare workers as well. But I think it's going to be key because there are many more viruses out there, not just COVID, and flu is potentially the most deadly of all. So definitely important.
So do you foresee a time in our not too distant future when we'll be getting our annual flu/COVID vaccine?
I do. I think there's no clear direction on that for now. It's February of 2022, and I think the majority of us have gotten three COVID vaccines, and we get our yearly flu vaccine. So my sense, and there are some studies showing kind of waning immunity between 4 to 6 months. Who knows whether we need just the 1 booster, or we need 2, or we need a yearly one. I would guess potentially yes. And so, that would be great if we could just get them on the same day and feel protected. But as we know, at least we know flu vaccine mutates yearly, which is why we have varying degrees of success with the vaccine efficacy. So, and COVID, at least we've had some waning of the immunity. So I would imagine that there would be kind of hopefully more to come on that from CDC, but I would imagine that we might get to a spot where we would be needing them regularly.
Okay, I think this is the last COVID flu so far. How much of a role do you think that viral interference between flu and COVID played this year in reducing flu levels versus social distancing, masking, and the other prevention measures that people have been taking?
Interesting question. So I'm thinking by viral interference, that person is meaning kind of higher transmission or higher circulating volumes, I guess, or proportions of COVID. I think it was primarily social distancing and masking. Flu is, droplet. It's a large droplet spread virus, can be spread by contact too, but I think it was primarily the masking. And, last year when flu season was, or flu activity was incredibly low, that was really when the world shut down for those few months. So I suspect it is more related to that rather than kind of viral specific characteristics. It probably didn't help that there was a new variant that was incredibly infectious and transmissible too, and so that probably didn't help either. But we've certainly had other viruses, being transmitted throughout this pandemic: rhinovirus, adenovirus, enterovirus, and so we're seeing that back again this year as well, just at much lower levels. So my suspicion is the latter, that it's social distancing, masking, and other measures.
Thank you. So I'm enamored of this declination form idea. I think it's great, and as far as it encourages people to really think carefully about their decision whether to get the flu vaccine or not. So I think that's a lovely idea. And we did have questions around the education that was provided for those folks who declined, including like what kind of education was it? Was it a webinar? Was it one-on-one? Was it something they were given to read? And then also, who provided the education?
Yeah, so it was kind of a hospital-wide initiative. So there was education provided throughout, which we usually do in terms of just like signage, and we have healthcare associated viral infection champions on units who will like bring up flu topics at huddles and that type of a thing. But for those that declined after the declination form, it was more dedicated like outreach. Hey, here are some stats on why we want to do this. It wasn't always one-on-one, it was more resources. So like, here's a CDC website, here's like some surveillance, here are high risk conditions, like here's why you should think about it. So it definitely was just like a kind of the next level effort to help folks understand the implication of this. And then ultimately, I think that got a little bit kind of overshadowed by the mandate, because then we were in kind of pandemic mode, and then that mandate came through actually a little quicker than I think everyone anticipated, and then that took over. And we still do our education. We have like roving carts in every unit. We have lots of flu topics. We have our OC health colleagues help us, our infection preventionists. So we do fairs and like kind of within the atrium. Less so now with the pandemic, but we did all of that from an educational perspective, and I think it's been really successful.
And was it your nurse educators who did the education?
On the units, we had nurse educators, yeah. So we would have some of the CNSs or critical nurse experts on the floors. We'd have the nurse managers and medical directors engaged with our kind of monthly meetings, and then we'd have the nurse educators do with a lot of our infection preventionists were or are nurses as well, and so they would kind of preferentially take on the educating roles because they had so much experience with that. So that's exactly true.
Important to have a trusted resource.
Yes, absolutely. And respiratory therapists as well.
Of course, really, of course.
Yeah.
What was the staff's reaction to the mandate?
Mixed. There was a couple of, I know there was mixed kind of opposing opinions, but I think overall was very well accepted. I think there's a culture here at CHOP of really putting, patients and patient safety first. And since coming here, I've really noticed that kind of strength. And so it really seemed to just kind of happen. And folks, I think for the most part, obviously not everyone, but for the most part, folks accepted it, and it just became a part of our culture. And now we just get our flu vaccine every year, and that is that. We do have an exemption process still, so there are, if folks want to submit for either a medical or religious exemption, there's a way of doing that where you submit your request and then it gets reviewed by a multidisciplinary team of occupational health, infection control, social work. We have spiritual services, legal. So everybody gets kind of, it's like an adjudication essentially. It's a very fair process. So that's how those get reviewed, but we don't have a whole lot of requests. The medical exemptions are usually fairly straightforward, and the religious personal can be sometimes a little tricky to navigate, but we have a great team that do that. So it's been quite successful.
And is there any accommodation made for people who actually have a contradiction to the vaccine?
Yeah, so there are people, like I said, who do have contraindication to the vaccine, and there had been in other institutions there had been kind of ways in which that risk would be mitigated, where they'd have to wear a mask for flu season, or if it was possible for them to go to a non-clinical area, they would do that. We didn't really have that option here because it was usually like clinical or non-clinical, and now we're obviously all masked in clinical areas, so that sort of took care of that. I'm not sure if we'll be masked forever, and it probably depends on the reason for the exemption, but there are some accommodations that can be made if you truly have if you truly meet the criteria for an exemption.
Great. Well, thank you so much. That is the end of our questions and our time. So that really worked out perfectly. Again, we really appreciate you coming and spending some time with us today. I love the very practical suggestions. I'm sure that a lot of those folks who are on will be able to apply those, if not immediately, then certainly for next flu season in their institutions. So thank you so much.
Thanks so much, Amy. Thanks for having me. Really appreciate it.
You're welcome. I just want to remind everybody who's on not to sign off because our meeting is going to follow. Just waiting for this. There it is. Okay. Okay. So our meeting continues with a very short update on flu and our Power to Protect New Jersey initiatives before we get to our member recognition, which I'm sure that's what everybody's thinking about, but I will be short. So the information that you see on this slide is from the most recent influenza and respiratory illness surveillance report, and that's from the week ending February 5th, 2022. As you can see, we have good news. The influenza activity level is now low across New Jersey, and that's the first week where it came down to low this year. Both emergency department and outpatient provider visits associated with influenza-like illness are lower than last week and lower than this same week of the 2020-2021 flu season. The most common strain reported is influenza A at 76.1%. Next slide, please. According to the CDC, we see a similar trend across the United States with a general decrease in influenza activity in most states. So far, there have been an estimated 2.1 million flu illnesses, 21,000 hospitalizations, and 1,200 deaths. Next slide. Although influenza activity can be challenging to predict, The CDC advises that it is expected to continue for several more weeks. Often in New Jersey, we see flu into April and beyond, so we all want to continue to remind clients and patients that it's not too late to receive a flu vaccine. Next slide, please. Our campaign continues to be active on the National Digital Network Patch, which has 100 local news sites throughout our state. From September through January 31st, we've had 1,048,198 impressions, over 1,700 clicks, and a click-through rate of 16%. Next slide. The Power to Protect NewJersey.com website has drawn interest throughout the season, with over 28,000 new users out of our 29,262 users, 33,871 sessions, and 45,132 page views. Next slide. To support your efforts as we continue to work to protect New Jersey, we've created 2 items to use to keep our campaign topmost in everyone's minds. The first is a magnet, which is featured on the left side of the screen, and hopefully you've already received that in the mail. We encourage you to post this magnet to let others know about our initiatives and resources. The second, which should be ready for shipment in the next week or so, is a stethoscope ID tag, and that's the picture on the right. So that's a little, like it's a round disc, and it clamps around the tubing for the stethoscope, and on the other side you can put your name. So this tag will, oops, too fast. The tag will assist healthcare providers in conveying their support of vaccination to patients. For additional quantities beyond what we will be sending, please contact me. Next slide. A final reminder about the printed materials for our 2 Protects 2 campaign, which promotes both flu and Tdap vaccines for pregnant women. Women who receive these 2 vaccines during pregnancy protect not only themselves, but their babies as well. This is an important message to share since pregnant women are at high risk from these viruses and newborns cannot receive the vaccinations. We plan to distribute additional quantities of these materials through this month and next. You can read more about the campaign and place your own orders on the partnership website link shown below. Next slide, please. And last but certainly not least, especially in light of Dr. Kitt's presentation, I wanted to remind you of this excellent infographic available for download on the New Jersey Department of Health website, promoting annual flu vaccine for healthcare providers. Next slide. So please contact me with any questions or if you'd like additional copies of our printed materials. Okay, next slide. And now the moment for which we've all been waiting. I would like to begin our awards presentation by acknowledging all Action Group members for your dedication to educating the public and professionals, as well as providing influenza vaccinations to our communities throughout the state. Although today we are spotlighting only 3 of our members, everyone's efforts should be applauded. Here are some of the flyers from events held in Newark, Trenton, Union County, and Paterson, which were shared with us and posted to our New Jersey Power to Protect website. I'm sure there were many more, so thank you. Next slide. We had so many event submissions from one Action Group member that we wanted to give our first shout out to Ocean County Health Department, OCHD. Located in central New Jersey, OCHD is headquartered in Toms River and serves a population of about 650,000 adults and children. In their flu vaccination brochure, By my count, there were 34 events scheduled, but I've been told there were many more. The staff has done an amazing job with their flu website, which includes flu prevention tips and frequently asked questions, information on treatment and resources. OCHD also provides information on flu and flu clinics via the department's app and various social media platforms. Next slide. We would also like to acknowledge the work of CamCare Health Corporation, a federally qualified healthcare center with 7 locations across Camden and Gloucester counties in southern New Jersey. CamCare offers flu vaccines 6 days a week at 6 of 7 locations. We're going to show you a promotional video that CamCare created regarding their support of flu vaccination. Thank you. Finally, out in the northwestern part of our state, St. Clair's Health decided to take patient outreach to a new level. Armed with our 2 Protects 2 educational materials, the parent education team at the Katina Center for Mother and Child at St. Clair's in Denville dedicated themselves to making sure that all patients delivering at their facility knew about the importance of receiving their flu vaccine to protect themselves and their babies. This involved creativity, determination, and using the personal touch, which, as we all know, goes a long way in spreading any important message. And now I'd like to invite my guests to turn their cameras on. Great. We have everybody? Okay, excellent. Well, joining me today, we have Scott Carter, who's the Chief Administrative Services Emergency Preparedness for the Ocean County Health Department. Want to give a wave, Scott? Thank you. And we have Melanie Berthott, Director of Nursing from CamCare. And we also have Anne-Marie Oswald, Patient Care Education Coordinator from the Katina Center for Mother and Child at St. Clair's Health. Thank you. Well, congratulations. Thank you for agreeing to participate in a brief Q&A so we can share some information about your events and your experiences with the other action group members. So the first question is really for everybody. If you could just give a brief overview of your organization's flu initiatives for the season, that would be great. I didn't go into them at any huge length in my presentation because I'm sure people would rather hear from you. Melanie, why don't you start?
Good day, and I wanted to also add, I do have Flossie with me. She's over there, but she's participating. So thank you all for attending, this discussion. For our initiatives, we offered vaccines to 6 out of our 7 locations. We offer it during well visits as well as sick visits. When we're administering COVID vaccines, we are educating and offering as well the flu vaccine. We're also hosting community events at schools, faith-based organizations, adult day centers, et cetera, to really just push the education out there, and of course to administer as needed for those folks.
Great, thank you. And Scott, how about a little overview of Ocean County?
Sure, afternoon. So as the primary health agency for Ocean County, we cover 21 of 29 municipalities with about 55,000 residents that are kind of assigned to us as the health department. we have a large senior population, we have a large transient population within the county. So that kind of gave us the ability to go out, not only in written form, but to get out in social media, but actually get out in a public setting by taking a lot of our mobile vans and be able to actually go into parking lots and go into these areas that we know are crisis. And we were able to really be successful this year with our program.
Thank you. And Anne-Marie, last but not least, tell us about the parent education program out at St. Clair's.
Good afternoon. Thank you. So what I did was I went out to the 13 OB offices that we have in our community, one prenatal clinic, one pediatrics clinic, and also maternal fetal medicine. And I passed out the brochures and posters from the partnership and asked them to put them in all the prenatal folders that they give out to the moms so that we can get the word out that way, as well as the information that I give out in our prenatal. We're doing e-classes online, as well as Microsoft Teams meetings. So I send all our pregnant moms who are in our classes information through the mail. I also sent them flyers as well. So make sure we get the word out to everybody.
Great, terrific, thank you. Scott, can you tell us a little more about your flu brochure, which I happen to have a copy of it here, and distribution, and how you ensure people in the community know about your events?
The brochure that you have is just one piece of our marketing. Because of our large senior population who are not really strong with public media, social media, we go to a printed brochure. So we pick our locations pre-designed, we print them out, go to each municipality. So each municipality gets those, they go to our county library system, our mall. We get them to actually then post that stuff on the social media for us. And then we also utilize a canvassing team where we know that we're going out to our pop-up clinics. We'll utilize those canvassing teams to hand out those brochures. So at least the individuals are aware of that. One of the other things that we do with the brochures is we know that the restaurant industry struggles with a lot of undocumented staff because we're a SURE agency as well. We take that to the restaurants and say, here, this is where we're going to be. If you have any staff that need to make sure for protection, come on over and visit. So although the world's in a social media platform, we've found that the actual print brochures have been very beneficial for us.
Great, that's terrific. Melanie, did you want to speak a little bit about how people in your community get the word about CamCare's events and services?
Thank you so much. Yes, we do plenty of outreach into the community. We have numerous networking, I guess, and resources out there to partner up with us. We utilize social media as well, Instagram, Facebook, Twitter, and we also, we post it at all of our locations to really get the word out. And what seems to work for us is really also word of mouth. The communities, really do trust us, and we really appreciate that, and we take it to the next level and ensure that we over communicate rather than under.
Thank you. I just wanted to read this quote from Dr. Monica Burton, who is the director of pediatrics for CamCare, because we were really struck by it. So Dr. Burton said, at CamCare, we recommend flu vaccines to all babies, children ages 6 months and older. Influenza A and B circulate in the community primarily in the winter months. Although influenza is generally an acute, self-limited infection, it can be associated with significant respiratory problems and death. When the community gets vaccinated against flu, we not only protect ourselves, but we help to protect all those around us. We are able to give the flu vaccine when your child is well or has a mild illness. We strongly urge everyone who's able to get their flu vaccine as soon as possible. And of course, the clinical team is vaccinated against the flu. So that's certainly a very strong message from a trusted provider. How else do you get people to participate at the events? Do you want to handle that, Melanie? You want to take a shot at that?
Absolutely. It really is, yes, education, of course, but to bring excitement, to take care of yourself. There's a lot of, push that at least we believe in terms of don't forget to take care of yourself. How are you going to take care of others if you're taking care of others, if you haven't taken care of yourself? And so a lot of that really is just, education, but then the excitement surrounding, taking care of yourself and preventing illnesses with a vaccine.
Got it. And Scott, how about in Ocean County? I know you talked about having more than just flu vaccines available at a site.
So we've done a couple of things. We have a program called Live Healthy Ocean County. So we take that to our health fairs. We take that to our senior communities and our partners that are there, which then comes with a health educator, comes with a nursing staff, just to handle all of the other health department questions and sickness and mental health and anything that they should have a need for. But this year we brought, along with all of our COVID vaccination response, we brought flu to everything there as well. So it was kind of a one-stop shop that they come in for any of the vaccines that they wanted, get their vaccine and their flu, or just their flu program, whatever their choice was. We incorporate pneumonia into each of those clinics as well.
Fantastic.
Amy, if
sure.
we all
Did somebody want to say something? Okay.
We also offer our flu vaccines to all our postpartum moms, and I'd have to say 99% of our postpartum moms take the flu vaccine, because we do tell them that they need to protect themselves for their infants. And 99% of our employees here at the hospital this year had their flu vaccines, which was very good.
Excellent. Excellent. Yeah, I know it's that you do it right on the postpartum unit, right? You offer it to the patients while they're there. So Anne-Marie, how do you prepare for those physician office visits?
This year, because of COVID, I found that when I got there were signs on the door that said I had to call. But I just called from my car and said, I'm here to drop off some flyers for you guys, and they let me in. I really didn't have any problem, and they said fine. Although there might have been some patients that were standing outside waiting to go into the office, they welcomed me.
That's great. Great to hear. I think you told me about some creative things you did with posting flyers in places where patients would see them.
Well, here in the hospital, I post the flyers in the bathrooms, so that I know there's 2 bathrooms out here in my hallway that I know patients stop in. So I made sure that there's posters out there. I made sure in maternal fetal medicine that they post them in the bathrooms in their offices and in the ultrasound rooms, non-stress test rooms, as they're sitting there, that they can read them as they're getting their non-stress test done.
Excellent.
And I asked the doctor's office to post them in their waiting room, as well as in their exam rooms.
Great.
As well.
Great. Meeting the patients where they are. That's terrific. So now I'd like to throw it out there. What were some unique challenges this year with the impact of COVID-19? Since we can't ever have a program without mentioning COVID, it seems, in the last 2 years.
So we went from almost no flu vaccination last year to probably just over 10,000 doses this year. And our biggest challenge was really saying no to individuals that wanted to host locations and clinics. And we were doing probably 2 to 3 events per day over the 5-day period, and it was a challenge. You know, we didn't want to say no, but we needed to kind of figure out the best locations and have some people travel just a little bit. And the second problem that we saw that we didn't anticipate was our homebound program skyrocketed homebound needs and homebound flu vaccinations. Many were afraid to come out during the world of COVID, and even still to today, because of their immunosuppressed, their concerns that they didn't want to come to the larger fixed sites that we had. So we wound up building out our homebound program with some of our additional nursing staff to take care of that need.
Thank you. And Melanie or Anne-Marie, do you have anything to add? Any unique challenges?
Just some of the things that we have seen down at Camp Care is, is that it's the missed opportunities more so than anything. It's like, I have, am I still shedding COVID, and can I still, I mean, there's a lot of inquiries, and, why should I? If I'm feeling fine, I get the flu vaccine, I might end up getting COVID. So a lot of misinformation as well. So there's a lot of focus on education and really having things in different languages that we can be printed, and to kind of do the myth busters as well, to really just push that communication out, because there's a lot of myths out there, and we, just a simple one-page tool to go over it and bust those myths really does help. So that's what we've been doing.
Thank you. Anne-Marie, what would you say were your lessons learned from this year's experience? Anne-Marie, do you have your volume on?
Yes.
What would you say?
I will continue to bring flyers to the doctor's offices to get that information out. I think that's the best way to continue to bring things to the physician's offices to get them to the patients.
Great.
Yeah.
Excellent. Does anybody have any additional tips to share with our colleagues? I know, Scott, in particular, you mentioned that you had pre-event team meetings, which I thought were very interesting.
We do. We bring on seasonal staff. So this year, I think I had about 130 nurses that were part of our response program and planning, to keep them all up to real-time information. As the CDC was changing, not only with COVID, but with flu, you can get flu, you can't get flu together. What we found is that as a county health agency, people are turning to us sometimes for the answers, and because they heard something different on media. So we found that every morning or before any clinic that we had, our clinical nurse lead was giving a basic 10-minute overview of what we had on the table today, what the new changes were with CDC. So that way the messaging was the same regardless of which staff member a person talked to. And we found that very engaging, because we learned from staff that worked in other hospitals and other places what was going on. And we were able to kind of take that in real time and make changes to better our program.
Terrific. Thank you. I think that's a wonderful idea, especially when the information was kind of like the moving target at various times this year. Melanie, did you have anything else that you wanted to share?
I just really think it's just to, empower your staff by, education and really just reassuring them that we're all this, together in terms of, vaccines and vaccinations for our community, and really continue to gain the trust of our community by education and being accountable to them.
Excellent. Thank you. And Anne-Marie, any final thoughts or words?
No, I think just making sure that we get those flyers out to our pregnant moms, so we can let them know how important it is to be vaccinating, whether it's the flu or against whooping cough. I think they're both important, and I try to make sure that we're even teaching our classes to make sure that we let moms know about that.
Great. Keeping it in the forefront of everybody's minds.
Correct.
Well, I want to congratulate you and thank you all again. I wish we were together in person, but you will be receiving these wonderful acknowledgements, certificates, congratulating you. You'll be getting it in the mail. And I want to thank you for being very active members of the action group this year. And now I'm going to turn the meeting over to Emily Haynes, who is the Director of Public Health Initiatives for the partnership, and she'll offer some closing remarks.
Hi, thank you, Amy. Good afternoon, everyone. I'd like to first thank our speaker today, Dr. Kitt, for her wonderful presentation. We learned a lot about how to promote flu vaccine with our healthcare workforce. I'd also like to acknowledge the New Jersey Department of Health Vaccine Preventable Disease Program for funding the Power to Protect New Jersey campaign and partnering with us on developing the materials. I'd like to thank the Power to Protect New Jersey team at the partnership, mainly Amy Gohl, for being the coordinator and collaborating with all of our action group members to highlight all of the flu vaccine events this year to help get the word out. I'd also like to thank Monica Smith and Karam Amadio for helping with the communications part of the campaign. Lastly, I'd like to thank and acknowledge all of our Influenza Action Group members. We have a large group and we're representing all of New Jersey statewide. And I'd like to thank members, especially Scott, Melanie, Flossie, and Anna Marie today, who were able to share some of their tips and tricks for promoting flu vaccine successfully in their communities. Thank you for all of the work that you do to promote flu vaccine and to keep New Jersey healthy and to keep our communities healthy. While this is the last meeting of the season, our work will continue. Please use this group and continue to use this group as a resource and a network for sharing ideas on promoting flu vaccine, sharing resources for getting the message out about flu vaccine and the importance of preventing flu in our communities. Remember, you have the power to protect New Jersey. I thank you so much for joining us today. Have a good afternoon.